And it is 8:30, and I call this meeting to order. First item on our agenda is public comment. D. Jones.
How y'all doing? I'm D. Jones, Grand Rising. First off, Commissioner Ponstein, I want to say something to you. I seen your comment after I had left Kent County Board. I had to leave, and I spoke on the budget and the Republicans controlling the agenda and setting the agenda. And I do want to say this, that I do believe that the Republicans do work with the Democrats, and I did say that. But one thing I do know is if you look at our federal government, the Republicans control the U.S. Senate, the U.S. House, and the presidency. And obviously when people control funding and they can cut funding, you see how it affects communities. So when people do control budgets and they control governments, we obviously see the effects of it. And so I care about you, Commissioner Ponce, and I'm not saying anything negative. I'm just saying the truth, that when people that don't care about the community control funding, usually people suffer when they only try to appease the billionaires and the big companies that keep them in office and power, and not the people that vote for them that's suffering and the communities that are struggling. But I believe that our Kent County Board is doing the best that they can during these unprecedented times, being sure that the operations are good, being sure that the policies are trying to be as just and fair as you guys tried to make them. Sometimes I feel like they aren't, to be honest, and if I didn't say that, I'd be lying to y'all. But I do feel like you guys do work with the Democrats to try to do what's best for Kent County. Also, just speaking on the operations, because you guys did partner with you guys, and you guys did continuously run the Youth Justice Influence Esports League that I developed with 17th Circuit Court, and I'm thankful for that because you guys did invest into that. Somebody bought brand new TVs and PS5s, and that is going to continuously keep going. That is an investment into our youth's future, into the justice system, to be able to bridge the gap and change the education system. As you guys know, I'll be bringing the largest in-person state finals and one of the largest in-person state finals in the United States to the DeVos place. That contract is sealed and signed. Even Brittany DeVos sent us the CIG grant fund to get the grant funding. So beautiful things are coming, and I can say that one of the DeVos's actually has been working with me to give back to the community. And eventually I'll get Dick, and I'll get Betsy, and I'll get all of those other billionaires, and hopefully the Van Andels, to also invest in the community, as I'm not going to let up, and I'm not going to continuously do what's best for the education system, continuously invest into our youth, and continuously invest into the citizens, the senior citizens, and the people that care about Kent County, as I care about Kent County, as I know you guys care about Kent County, as I care about the policies that you guys create because they affect us, and the ordinance and the budget amendments that you guys create that affect our community. So I ask you guys to keep investing into the good things and the operations that give us the best effect for Kent County. Thank you.
Thank you, Dee. Appreciate that. Is there anyone else that'd like to be heard for public comment? All right, seeing no one, we will close that part of our meeting. Next item on our agenda is approval of the minutes. Do I have a motion to approve last meeting's minutes? Motion by Packla, supported by DeBoer. Any other comments, questions? If not, all those in favor, please say yes. Yes. All those opposed, last meeting's minutes have been approved. All right. Next item on our agenda is our special order of business. We have two presentations today, so if we could try to do our best to keep that within a 10-minute time frame. I think staff's probably already let you know that. Commissioners might have a few other questions too that will prolong that a little bit, but we'll go with that when commissioners ask some questions. All right, first item on our agenda for special order of business, ready by 5. We have Kiana and Jasper.
All right. Good morning, commissioners and community members. My name is Kiana Garcia Zadarite. I am the program manager for Ready by 5.
Hi, everyone. My name is Jasper Tinoco, the data specialist for Ready by 5.
We want to thank you for giving us the opportunity to speak about Ready by 5, what we're doing in the community here, any progress that we've made, what we've learned, and where we're headed. Everyone at Ready by 5 believes that all children deserve the opportunity to reach their full potential, which is why Ready by 5 funds services and organizations that ensure that children are born healthy, thriving, and developmentally on track, and ready to learn when they start school, with an overall goal of ensuring that they have opportunities to be ready for success in all forms, but especially when they step foot into the classroom. Many of you know what Ready by 5 is or who we are, but I'd like to give a high-level overview of what we do. Ready by 5 is a voter-approved early childhood millage generating approximately $8 million a year, aimed at improving the lives of early childhood and families here in Kent County by funding 4 major category areas. Those are parent education support, early learning, outreach and navigation, and healthy development. Those further break down into the areas that you see here on the screen, such as prenatal support, developmental screenings, assistance navigating the early childhood system, home visiting, play and learn groups, elimination of hazardous substances, and intensive therapy for children dealing with behavioral issues. What I'd like to do now is hand it over to Jasper to discuss Ready by 5's overall engagement, services, and impact.
So from the beginning, Ready by 5 has been committed to making programs widely accessible while also being strategic, focusing efforts where it can make the greatest impact. This and the next few slides demonstrate both sides of that commitment. First, you'll see that early learning programs like Play and Learn draw the highest participation. That makes sense because they're designed to be broad, universal services across the county. In contrast, more intensive services, support like healthy development and parent education support, naturally serve fewer families, which is expected. Second, participation is heavily concentrated among children ages 0 to 3. That's exactly where the greatest needs exist, since state and federal investments provide tuition-free preschool for 4-year-olds and some 3-year-olds, but there are far fewer resources dedicated to infants and toddlers. The millage helps fill that gap. And finally, participation overall continues to climb. We saw an 8.6% increase from 2023 to 2024, with nearly 15,900 individuals served. So the slide outlines how Ready by 5 directs resources where they'll have the greatest impact. So on the right, you'll see our evaluators at Basis Policy Research call the Early Childhood Opportunity Spectrum Map. The darker zip codes represent areas with the most opportunity for impact, places where economic, health, and community indicators suggest that additional support can significantly improve children's readiness. It's important to note that nearly 3/4 of young children in Kent County, ages 0 to 5, and about 73% live in these urban and outer urban areas. That's where the need and the opportunity overlap the most. And participation does reflect this. Outreach and navigation serves about 80% of families in these areas. Early learning reaches 76%, and healthy development 93%, while parent education support 95%. So the most intensive services are concentrated right where they're needed most. At the same time, we're working with providers to expand participation in rural areas, especially where there's still significant opportunity. We've also dug deep into the referrals to understand how families are connecting with services. And so in 2024, 14 agencies made nearly 8,000 referrals, an 18.5% increase from the previous year. The number of individuals referred grew by 15.5%, and about 74% of those referrals were completed. It's important to recognize that needs do vary. So some families require only a single referral, while others are connected to multiple services. The top referral categories were home visiting, outreach and navigation informational calls, and food access support. And when we look at the geography, the highest concentrations of referrals come from the urban core zip codes, which is 49507, 49503, and 49508. Altogether, this tells us where demand is highest and how families are engaging with the system.
When we talk about evaluation, our guiding question that we've used is, what does it truly mean for a child to be ready for kindergarten? And the kindergarten readiness framework that we have breaks this down into core skill areas, not just early literacy and numeracy, but also emotional regulation, social interaction, behavioral self-control, communication, problem solving, and even physical attributes like fine gross motor skills and general health. So what we do is we partner with independent evaluators like Basis Policy Research in an attempt to measure growth in each of these areas. And one lesson that we've learned is that readiness is not one-dimensional, and success comes from supporting the whole child, including social, emotional, and physical development alongside those academic skills. Ready by 5 evaluations include 3 questions, and the impact analysis that many of you all have seen addresses the third question. What is the impact of Ready by 5 services on a participant's health and academic outcomes? We have 19 school districts that have participated, and 13 have completed the assessment data from 2017 to 2024. The analysis has included 2,780 students who participated in Ready by 5 services since 2021. There were 3 assessments used and administered across these districts, and researchers established a score threshold or a cut point for each assessment to determine whether a child was academically ready for kindergarten. And to make a fair comparison, each student who received a Ready by 5 service was matched to a similar student who did not, based on factors like school, race, gender, and this was using a statistical method called logistic regression. And it was used to estimate how likely these students were to be academically ready based on whether they did receive Ready by 5 services. Currently, Ready by 5 uses data and it includes students that have had at least one touch point with Ready by 5 services prior to kindergarten. And that data does not identify what type of service the child received or how long they were enrolled in the service. For example, a child who attended 15 play and learn groups is treated the same as a child who attended one and had their home tested one time for elevated lead levels. In the future, what we're hoping to achieve is that we will have universal identifiers associated with each individual student who has a Ready by 5 participation. And these identifiers will allow us to identify the type of service and the length of service that occurred. So this opportunity gives us a more complete understanding of the relationship between the service type, level of participation, and their academic readiness. And we finally get the answer to the question, what does Ready by 5 services do and how are they related to improved outcomes? There are still some limitations with this, as we have no state or county-wide measures of social, emotional, or physical readiness of kindergarten. So again, our focus is limited to only academic outcomes. And less is known about students who don't participate in Ready by 5 services, including participation in early childhood services and preschool enrollment and family income and so on.
So the first six years of the millage have taught us a lot of valuable lessons. We've seen both strengths and gaps in our data and process, and in some case, information that wasn't key, like answering our key questions we care about most. So to make that, we're making changes. Reporting will be streamlined with clear definitions and fewer unused fields, reducing the burden of aid for agencies and improving coding options for greater consistency. And we're building active logic models to better align with outcome metrics with what matter most, capturing not just activity, but meaningful impact. The outcome is a stronger, more intentional system that's holistic and reduces burden, provides insights and aligned with strategy, and supports evaluations for better impact and outcomes. Going forward, we're not just asking how many families did we serve, but we're also asking how many families know about these services and aren't using them and why. Together, these improvements, along with the updated systems, position us to better support families, elevate our impact, and contribute to meaningful change across the community.
What we'd like to do now is bring up one of our community partners to give a little bit of a testimony to how these programs operate.
Thanks. Good morning, everyone. My name's Kristen Gietzen, and I'm the president and CEO at Arbor Circle. And we're a mental health and social service organization, and we receive funding from a variety of public sources, including Ready by 5. So thank you for that. It's been quite a success in our programs. I'd like to start with a brief story that sort of captures the heart of what this program is all about. A young child who was 3 years old and living in the northern part of Kent County was referred to KEEP after being expelled from 2 daycares due to aggressive and unsafe behaviors. He was able to attend school a few days a week, but when summer came around and he needed to transition to full-time daycare, he really struggled significantly. Staff felt threatened by behaviors and outbursts. He tried to escape from the classroom setting, and Mom really felt helpless and desperate. She would receive phone calls from the center while she was at work. Many of you have probably had phone calls like that when you have a child that needs to be picked up and you're hoping like, whoa, I hope this is no big deal. But she received these phone calls repeatedly, and it was really impacting her ability to maintain her employment. So our KEEP staff worked closely with the daycare staff and with Mom to understand the child's needs, to build strategies for connection in that setting, and to support the child's regulation. And over time, through a variety of interventions, he went from attending daycare just a few hours one day a week to attending 5 full days a week. Mom was so relieved. She was able to maintain her employment. Teachers reported that they were better able to manage his behaviors. And overall, those caregivers, Mom and the child care staff, were just joyous that this child was achieving some success and was able to stay in his child care location. So I tell this story because it's fairly typical of the kinds of things that we do with KEEP. KEEP stands for Keep Early Education Positive, and we provide specialized clinical support and consultation by a master's level staff to child care providers, teachers, families, when a child is having difficulty in a preschool or child care setting. Early learning and a preschool setting can be overwhelming for all children, but when a child is having a hard time regulating themselves and is impacting the peers and the other students in that setting, that can become real problematic for not only the child and the family, but the staff who are trying to maintain a safe learning environment. The program provides assessment, observations at multiple times of day, feedback to the staff, and a variety of interventions. And the goals include reducing suspensions and expulsions. Many people are surprised to hear that children can be expelled from a child care setting. Often it's couched in that your child is no longer a good fit here, or your child is impacting other students, and we're asking you to find a different child care location. But suspension and expulsion is the language that's used in educational settings, and so it's adapted in this program as well. Another significant goal of the program is to reduce the teacher or child care staff burnout and turnover. I know with your interest and priority in child care, the fact that we're having a hard time as a community staffing child care centers is a big concern. And the burnout that teachers feel because of either the lack of support or the child's behaviors has become real problematic out there in the field. So making sure that our that our teachers are feeling supported and able to control and actually teach something to young children is a real priority of this program as well. Overall, the child care staff report that KEEP improves their mental well-being, their overall well-being, and their job satisfaction. They feel more confident in their ability to handle challenges. They see the children being successful in the placement, and they feel more connected to the students and the families. We gather feedback from child care staff regularly through surveys and interviews, and we do the same with the families that we serve. At its core, KEEP is about relationships and creating safe spaces for children and childcare providers to be successful. It's helping children to stay in classrooms, helping teachers to stay in their roles, and helping families to feel supported and maintain their employment. Last year, we provided interventions to 50 classrooms all over Kent County, everywhere from Caledonia to Sparta and Cedar Springs, Wyoming, Lowell, as well as Grand Rapids. We reached a total of 711 children, and we are thrilled to be able to continue providing this service. Thanks.
All right, thank you so much.
We'd like to give the opportunity for any questions if we have any. We should be under our time limit.
bet.
Everyone practice, so.
Love it. Thank you so much. I appreciate that. Commissioners, Commissioner Pakla.
Thank you, Mr. Chair. Thanks for being here. Great presentation. I always enjoy hearing about the great work that you all are doing. Can you talk a little bit about the mainspring work that you're doing and the opportunities that we have to both support home-based providers and maybe even our interest in how we might evaluate that work? Because I think it's got a lot of great potential from what I've heard, but I'd love for the group to hear more about that.
Yeah, so as an overall, I'd like to clarify that Mainspring is not a part of Ready by 5. We have an umbrella organization that is called First Steps Kent, and then we have 3 pillars of our organization, which is early child care and education, or Mainspring, Ready by 5, and then we have Impact. Impact does our policy and legislation. They do a lot of our grant work, and Mainspring handles our FCCN, which is our child care network, and most of those individuals are child care business owners or in-home care business owners, and they advocate on the Hill, they advocate at the state level and locally to ensure that there's better policy, possibly that comes down from Laura, that enables easier transfer of skills and licensures so that individuals can open businesses or maintain open businesses. There's a lot of opportunity for us to expand the network. There would also be a lot of opportunity for us to get more individuals on the FCCN seats and sitting at the table to advocate for better policy and legislation. Does that answer your question?
It does,
Okay.
yeah, thank you. I do have one more question, and it's about the study, and so I understand that 13 of 19 school districts are responding to that. Is it a self-reported response? They're sort of checking to say, kindergartner, did you participate in a Ready by 5 activity, or is there some identifier that follows the student from pre-K into the school district?
Are you able to answer that one?
I guess,
Okay.
yeah.
So what Basis Policy Research does is they reach out to all of the districts and they gather local feedback from them in focus groups. So they're getting that information from the districts themselves and they self-report back to us with de-identified information.
Okay. Yeah, that's helpful, thank you.
Commissioner Faber.
Thank you so much for being here. This was really helpful. I was around the table in 2018 when we started this work, and there was a sense at that time that we were definitely building the airplane as we were taking off, and so to actually see now these data systems checking up with or getting caught up with a system that traditionally was not very coordinated is really amazing to see.
Thank you.
On that front, just 2 quick questions. One, Kent County is unique in having an early childhood millage. I don't know that there's any other counties in Michigan right now, maybe one. I know some have tried. So, part of the data, yes, it's about moving forward, but it also may be about not falling behind. So it may be just keeping us where we're at as well. And so I don't want to be deceived that if we're not seeing some things, that means that we're not doing good work. There was always this pressure to move the needle. I think that was probably the most common phrase I heard and have heard from this commission. Sometimes moving the needle is about the needle not moving. It's about staying where it is. So could you talk a little bit about how you're looking at Kent County comparative to other communities? Because, comparing to ourselves and the system that we're all in may not show us exactly what's going on. And then any other trends, like big level trends that you guys are seeing in sort of this early childhood space would be really interesting to me. I know COVID kind of gave us a big pause in a lot of this work, and now I'm assuming a lot of these numbers are because we're rebounding. And finally, so that's kind of the comparative and trends. And then the third is really how have these dollars been used to leverage other dollars in the community or bring other resources? A lot of times we find with these millages that by having this baseline of funding, we're able to do and reach for other funds that may have not been available to us before.
Yeah.
Thank you.
So I'll start with your first question. One of the limiters that we have as Ready by 5 is we are limited to Kent County specifically. So we have difficulty getting information from external counties. And that is because there are legal contracts that bind us to the data that is warehoused here in Kent County. So we have difficulty getting things from Detroit or from Traverse City, up north or other counties in Michigan. What we do have is standard research that's available countywide, district-wide, statewide that we can access, but again, that's not identifiable research, and we can't link it back to early childhood. So that is a gap and a limiter in some of the research and understanding that we have in general. Some trends that we have, to answer your second question, for early childhood is that we are seeing the service needs change all the time. So something that Ready by 5 has not funded before is food service needs. And upcoming, we're planning on adding some food service needs into our community RFPs. And so this would enhance an opportunity for children to be able to access food in an appropriate manner that helps support them to be ready for learning in all opportunities. Third, your question was in regards to, remind me.
Leveraging funding.
Leveraging funding. So Ready by 5 generates approximately $8 million a year. What we had this year was a little bit of difficulty from the Resident Proposal Review Board when there was approximately $14 million requested and 35 almost organizations that requested funding. And so there was the unique instance that there was less money to allocate than was even requested for services that have already existed in the community. So what we have done is ensure that we are foundational and clarify to organizations that we are not meant to be fully supportive using Ready by $5, that we are meant to be supplantive funds in tandem with other funds as organizations try to shift and work with what's available in the community.
All right, thank you. Commissioner Womack.
Thank you for your work and your service to everybody in your organization. I've seen a lot of positive benefits in our community from Ready by 5 and your partners. My question was, what in your system would do early detection of ADHD and other behavioral disorders that might affect their education? And once it's identified, is there any type of counseling or a component that can help parents with children that are struggling through ADHD and other behavioral disorders?
Yeah, I completely understand that. That's a sentiment that as we get more research out in the community, ADHD is becoming a lot more diagnosed, especially in early childhood. Something that we have is healthy development and outreach and navigation services so that, I'm just waiting, I didn't know if you guys were able to hear. So we have available services in healthy development and outreach and navigation to ensure that children get referrals to services that make it easier for parents to have a diagnosis available and ready for them, and then they're able to achieve other services.
Okay, thank you.
Yeah.
Thank you, Commissioner Womack. I think I got hit there, and so did my kids a little bit on the ADHD, so I think you can talk to other commissioners on that. So that's why I kind of was chuckling when Commissioner Womack said that. Commissioners, any other comments or questions? Just a couple things on the food program that you might be bringing in. Are you going to work with any organizations? I'm thinking like Hand to Hand. I mean, I think that's more school-age children, but are you working with any organizations such as them that might come alongside you?
So this would be an RFP potentially that we open up, and it would open it up to other community organizations that already have food services available that give access specifically to children 5 and under. And then their families would be able to access that as well. So we haven't had any RFPs for it yet. This would be the first iteration.
Okay, all right. And then I guess, again, the statistics from year over year, I thought those were very interesting. I guess maybe a quick little comment from, I mean, this millage kind of kicked off in the height of COVID, or at least you started and then COVID kind of happens. I guess, what do you see as maybe the biggest change that we got through COVID, we're a little back to normal? I mean, is there some, I'm putting you on the spot, is there some direct impacts that you say, wow, we really noticed this, or we noticed that?
That really is. We have very different roles at Ready by 5. So what I notice may be very different than what Jasper notices. He has a very technical lens to things. For me, what I notice are the needs that occur in the community all the time, ongoing, and those shift. They're never the same. And what I have to do is ensure that I'm able to meet the needs of the community at a grander level. And more at a micro lens, Jasper could talk about a little bit of the data and how that shifts and changes every year.
Yeah, so just being put on the spot here.
You're welcome.
Yep, thank you for that. Overall, it has trended upward as far as the participation rates go. Steadily, I want to say, in 2019, we served maybe 500. And then from that, it jumped to like 2,000, 3,000, and it's just been going in an upward trend. About, on average, maybe 8%. In terms of actual participation, outreach, those trends seem to change over just year to year, like calendarly. The agencies that we are working with referrals, I think just in this broad complex, we've seen about 700 or 800 different referral agencies just in 2024 alone. So it's kind of just speaking in depth about what, how complex and interconnected the system all is. And that changes from year to year. So that's all I have on the spot right now, but can definitely get back to you about that.
Well, I appreciate that. Thank you so much for being here today, and commissioners for the great questions. So again, appreciate the work, and the data was really good to see. So thank you so much.
Thanks.
All right, next item on our agenda, on our special order of business, is the Area Agency of Aging of Western Michigan. Kendrick Hinline.
Good morning, everyone. Thank you for the opportunity to come here and present today. I'm Kendrick Heinlein. I'm the president and CEO at the Area Agency on Aging. I'm going to wrap up all the great work that's been taking place in this county in 10 minutes since 1999. I look forward to the questions afterwards regarding our services, whether it's about the Area Agency on Aging or the Kent County Senior Millage specifically. So I want to take you through what does a day in the life of a senior in Kent County look like. Typically, it starts with breakfast, then medication at 9 a.m., bathes and gets ready for the day, leaves the home, attends a doctor's appointment, comes home for home cleaning and chores. 5 p.m. starts with self-care, and then 7 p.m. ends the day with safety. And because of the Kent County Senior Millage, we're able to wrap these services around our older adults in Kent County with the services provided and the funding provided through the millage. So this previous slide there now looks at what our service partners and what our services going into the community to take side by side with that senior through their day. So that meal, when we talk about breakfast, starts with a home-delivered meal. For Meals on Wheels of Western Michigan, Revive and Thrive Community Food Club, we have a lot of great options that we're able to provide for those services. Then it becomes medication management, where we're able to work with our seniors to make sure that they not only have the medication they need, but they are doing it in a safe manner when they are taking those dosages. Then we have assistance through a personal care aide to help with the bathing and getting ready for the day. We have home repair services able to make a barrier-free entry for that individual to be able to leave their home, whether it's widening a doorway so they're able to get an assisted device through, or putting a ramp on the home to make sure that the steps that were previously used and are no longer able to be are removed as a barrier for that home. And we have our transportation providers that can take those individuals to and from appointments, grocery shopping, or to different community and social events. In-home support to make sure when that resident or that individual gets home that they have the support they need, whether it's with house chores or getting ready for dinner. We have that assistance there. Then we have the virtual therapy for that assistance for the socialization, but then also those therapy services, which can be brought right into that individual's home, so they're able to have access to that. Then last but not least, we have the personal emergency response button, or a PERS as we commonly refer to it at the agency, where that individual or their caregivers can know that they are home and that if they do need that assistance, they're just a button push away from getting that care that they need for their daily lives. Why is the senior millage important? So as I touched on earlier, we have 25 plus years of results. We've been operating this millage since 1999 here in Kent County. 1 in 5 Michiganders are already 65 or older. That will be 1 in 4 by the year 2030. Supports and autonomy, we know that individuals, 3 out of 4 older adults, and when I say older adults, I'm talking 60 and older, want to age in their homes and in their communities. So we want to make sure with the senior millage and at the Area Agency on Aging of Western Michigan that we're able to provide that support and give those individuals every opportunity that they have to be able to age at home and in their communities. Then also when we look at the cost effectiveness, so hospital stays can cost on upwards of $30,000. When we look at these proactive services that we're able to provide, whether it is nutrition, transportation, in-home care, we can do that, for instance, less than $500 per person through the millage network that we see. We really want to work at being preventative and proactive to make sure that we are helping these older adults before they have to have an emergency room visit or before they are going into a nursing facility. We want to be that step in between them having to make those choices or having to make that visit to make sure that our services are able to get into the homes and into their communities to prevent that from ever having to happen in the first place. When we look at the ripple effect, we talk about leveraging funds. So when we look at how we're able to leverage these services, not only with the millage, but through all the other funding streams that not only our agency, but our partners use, we are able to use this spending to leverage nearly $3 for each dollar spent in the system. So that means for every dollar goes into the system for these preventative and for these services that we're able to save on average $3. We're able to lower the taxpayer cost at home care and nursing home care, so we are much more efficient at the care we're able to provide and much more cost effective on the system as a whole for not only the taxpayers, but for the individuals receiving this care, that we're able to provide that at an efficient cost. Caregivers, so when we look at caregivers and the job market and their daily lives, we often say that caregivers work a 40-hour-a-week normal job and then they have 40 hours for their caregiving duties. And we're able to be that assistance and come alongside those caregivers to make sure that does the individual they're caring for have a ride to an appointment? Do they not need to take time off from work because we have respite care that's able to come into the home? Or we have adult day centers that their loved ones are able to go to and make sure that those caregivers can not only be active members of the community and in their personal lives, but then they can also have the peace of mind to make sure that the person that they're caring for is receiving the care that they need. Then ultimately, all that funnels down to the older adults being able to age at home. As I said earlier, 3 out of 4 want to do so, and we want to make sure that we give them the resources to do that. So accountability and oversight. When we look at the decisions and how this process runs, we're very proud of the services that we're able to provide, but we're also proud of the administration and oversight that goes into these systems to make sure that it's never lost on not only our agency, but the individuals and the organizations receiving these funds. These are taxpayer dollars, and they need to be efficiently used. They need to be spent in a way that not is only sound as a fiduciary of these funds, but then making sure that the intent is there behind it, which ultimately makes sure that those older adults are aging in place. So how do we go about that? We have a 9-person Kent County Senior Millage Review Committee, which is made up of not only Kent County commissioners and representatives from the Kent County Administrative Office, but then we have older adults that also make up that review committee that not only lived in the community, whether they've accessed the services or worked in the aging field to make sure that these dollars and that oversight is there when those funding decisions are being made. We collect data and reports on a monthly basis. So we use that data to not only inform our funding decisions, but then we also look to make sure that we are holding those partners accountable for the funding that they are receiving. So we use that process and our expertise that we see in the other 8 counties that we serve outside of Kent County to make sure that those decisions and that decision-making process is fundamentally and data-driven as it can be on a month-by-month, year-by-year basis when we are having these funding discussions. And then responsible spending. On average, we average about 98% of the funding being spent. We always like to leverage that as close as we can to 100, also realizing that we need to have a little cushion in there to make sure that these partners are being reimbursed for the services. But on average, we make sure that 98% of the Kent County senior millage funds are spent on an annual basis. What does that translate into? So for fiscal year 24, which runs from October through September, there was $15.2 million spent, which equates to 98% of the original budget on the Kent County senior millage. That went to serve 20,439 unduplicated. And I like to call out that unduplicated portion because if we were going to do duplication, that number grows even more. But those are individuals on an unduplicated basis that are receiving that service on a yearly basis. We offer over 45 unique services, 54 contracted and purchase of service partners, and then the clientele demographics that we see for at least fiscal year 24 is broken out for you to see there. I'd like to highlight that 31% live alone. There was a question earlier about what have we seen coming out of the pandemic that's changed. And I would say the social isolation is one thing that's come to light for our agency coming out of the pandemic, and the negative effects of somebody that is socially isolated on what it has for their health, their mental health, and their overall well-being is great. And so we've turned our emphasis to make sure that while yes, it's important that they have meals and they have these different services, making sure that they have activities and they are not isolated has been something that we've shifted our focus to as well. 34% were low income, and then 15% served were veterans. When we look at the community-wide reach, so 40 out of 40 zip codes in Kent County were served. We had 12% client growth, and that is our average annual growth we are seeing for clients served. Since 1999, when we started with 7 partners, we've grown that to 30 plus, not including our purchase of service partners in that as well. And then our organizational-based framework to make sure that our programs are served and that specialized community-centered care is coming from those independent organizations that operate and live throughout Kent County. Wraparound support, when we say we want to make sure that we give older adults in our region every opportunity to age in place, this is what we're talking about. Really coming and serving these individuals on what their aging process looks like. And I say aging process because it changes for everybody. If you've seen one aging process for an older adult in Kent County, you've seen one aging process. And what individuals need often varies. So whether that's caregiver respite, home repair services, or mobility equipment and assistive devices, legal assistance, transportation, outreach and assistance, in-home care, healthy aging, which is matter of balance, Tai Chi classes, or nutrition, we want to make sure that we are being mindful of the millage that we're able to offer and meet somebody on their aging journey, regardless of what it looks like for them. And how do we do that? Really, it's our partner network. You know, I come up here and I talk about the Kent County Senior Millage and I talk about the Area Agency on Aging. And while I'm immensely proud of what we do at the agency and how we provide these services, it'd be all for naught if we didn't have the partner network that we're able to rely on. So they're highlighting the partners that really bring these services to life. And I wanted to give an example about how does this partner network really interact. Here's an example of somebody that received a home assessment by an occupational therapist, which then led to, after that assessment taking place, they needed a ramp. So they connected with Home Repair Services of Kent County to add that ramp for their home and also widen their doorways so they're able to either get a wheelchair or an assistive device through that doorway in their home. And then Disability Advocates of Kent County provided a transfer bench into their shower. So they're able to access and safely access their shower and making sure that they have the bathing and the hygiene regimen that is going to work for their daily activities. And then Renew Mobility was contracted in to provide a wheelchair. So prior to the assessment taking place, they were using a wheelchair that was quite frankly just unsafe. And so for the therapist recommended all of these services based off of one assessment that they have access to because of the Kent County Senior Millage. And ultimately what that lends itself to is that individual now is able to age in their home in a safer and have more well-being in that home as well. Cost effectiveness. So not only do we reduce healthcare costs, I want to draw your attention to nursing home care. So oftentimes we get asked the question, are we against nursing facilities? Absolutely not. Nursing facilities play an active role in the aging process, and they play an important role in the aging process. We want to give individuals in Kent County and the other 8 counties that we serve every opportunity that we can to be able to choose if and when they have to go to that facility. And while we're giving them that choice, we're also saving the overall system money. You can see there on average $245 to $396 a day is the average cost of a nursing home. Kent County Senior Millage Care Management, where we look to bring those services into a home, costs on average $485 a month. So not only can we be cost effective, we can help keep those residents in their home, and we can hopefully reduce the burden we see on our finances as the state of Michigan and Kent County as well of keeping these residents safe in their home. And then client contributions. So $559,000 were contributed to the Kent County Senior Millage in '24. What that lends itself to is that goes directly back into the programs and allows us to provide $559,000 more services in that given fiscal year. So if you have a budget of $100, you collect another $100, your budget now is $200 because you're expected to put that back into the system to be able to provide those services. When we look ahead, we have engaged in a Kent County Senior Millage strategic plan. The needs in the aging population is ever growing. The dollars are not keeping up. The funding is limited. We have to make tough funding choices each year, and that need is ever, and those choices are ever growing. So we're going to hopefully use this strategic plan to be as strong a fiduciaries of these funds as we can, but then also make sure that we're staying true to our values and recognizing what our pillars are for the aging community. And then we're also going to be looking specifically at the agency of where can we fill gaps in care. And primary care and palliative care is something that we're going to be engaging in. We have already engaged in primary care through a collaboration with Senior Resources, our sister company area agency over in Muskegon County. So we're going to be working with Muskegon, Ottawa, Oceana, Kent, Allegan, Ionia, and Newaygo initially to provide in-home primary care services, and then look to provide that palliative care as well. And why are we doing that? Because where we see we want a resident, an individual, a senior, a caregiver, when they come to the area agency, that they can stay with us through the end of life. We think we're uniquely served, uniquely qualified to be able to assist these older adults, and the more we can expand our services and push the envelope, the better off older adults, not only in Kent County, but the region that we are covering, are going to benefit. I think I hit my time. I will open it up for questions.
Hey, love it. Thank you so much. Appreciate it. Nice job. Commissioners, some comments, questions, or concerns? Commissioner Pakla.
I'll go first again here. Kendra, thanks for being here. I was struck by your $500 versus $30,000 data point that happened earlier in your presentation here. And I'm wondering if you have done sort of an annual analysis or an over the course of this work analysis of just how much money this particular set of efforts has saved individuals, has saved insurance agencies, has saved the public, right? I mean, because I think that's a remarkable number there. And it really goes to show what happens when we invest in a big system in a proactive way, in a systematic way, as opposed to just responding to things as they come.
So we have not done a combination of looking at, say, a 10-year look back to say what we've saved. It is something we're looking as we are changing the way we're using our data to annualize that number, not only for individuals in presentations like this, but then also for legislators to be able to say, this is what we can do for the system, this is where that investment can look like, and when we are looking at being good stewards of the funds, this is why that is an investment that needs to be made.
Okay, that's great. Yeah, I think that would be a really phenomenal story to tell of the great work that you're doing. The other question I had was, a couple years ago, a number of commissioners went down to Travis County, Texas, to the National Association of County Officials Conference. And down there, we heard a lot about how their officials in the homelessness conversation were very proactive in thinking through the outreach to individuals that might eventually need services. In particular, they talked a lot about the seniors, where you had a spouse that was the financial caregiver or the financial knowledge holder of the household. That spouse dies, the remaining spouse doesn't have a good understanding of how the finances are, you know, what the checking accounts are, where the different pots are held, that kind of thing. Can you talk a little bit about whether there is currently systems in place to be proactive in that kind of sense, or is most of the work that's happening kind of reactive? Somebody is identifying that there is a need and they're looking for services.
So the proactive approach, and in the example you gave, I would say our outreach and assistance is that proactive arm of our partner network, where we are looking to get somebody in our system and making sure that as their aging journey changes, we're able to be proactive and get them the services. I will say in that example, we have a daily money management that we saw come out of an example just like you gave, where individuals needed to learn how to manage, whether it's bills, manage savings, checking accounts. But the only way we're able to know that is if they are already in our system. So we've been much more intentional about whether they're receiving a home-delivered meal, whether they're receiving a ride, making sure that they are aware of the services available to them, so that if they've taken that initial step to enter the network, that they can access these services. And ultimately, oftentimes we find that access is just knowing about the services. So, yep.
All right, any other commissioners? Commissioner Faber.
Yeah, thank you so much for the report. A lot of us spent last summer pounding the pavement with our campaigns, and half the time I felt like I was doing wellness checks on my neighbors. And, you know, it really, I think, I would love for you to speak a little bit to the trends that are happening, especially as it relates to housing. My experience was we have a lot of folks that are really locked into their home right now. Their mortgage is paid off, their property taxes are capped. The next jump to the thing that they have to go to, whether that's independent or assisted living or a nursing home, the costs are just outpacing whatever they've been able to secure over the last couple decades. And so, you know, as we think about everything I've seen from a trend perspective is we are aging. We are going to have more older people that are going to need these services and access this. At the same time, we appear to have federal government that's dialing back support. How do you see these things kind of impacting us, and specifically, are there anything that we can get ahead of in the next decade that you think we should be investing in? Thank you.
Commissioner Faber, I'm going to leave you my card. I can go for about 2 hours on everything you just said there. So when we look at housing, and we look at, really there's three main points that we are seeing with seniors in Kent County. Either they are being priced out of their home and do not have the ability to meet that increased cost because they are on a fixed income. They have their home paid off, but they're unable to afford the upkeep of that home, or that home is no longer livable, because let's say it's 3 stories and they really need to be able to access everything on one main floor. And then we have access to housing and some of the zoning requirements we see in the different municipalities that we work in. Where we're trying to be proactive is we're trying to leverage the partner network that is, I would say, experts in this space. So when you look at whether it's your dwelling places, your habitats, you're looking at even the shelters, some of the things they're doing with their transitional housing, we're trying to see how can we be proactive while knowing we're never going to have a service to increase somebody's monthly income to be able to afford that cost. So it's looking at a few different things, such as can we get different zoning requirements that allow for intergenerational households, where somebody comes back and they live with younger adult, or they live with, their family and have that intergenerational component? Can we have more facilities when they are being built, whether it is the smaller homes that we are seeing starting to have some traction, whether it is the different community homes where you have, 54-unit complexes coming up, to where we can be advocates to require that 25% of that census needs to be available to low-income seniors so that they're able to access that. And then when we look at the home repair side of things, can we partner with a Habitat to enter into a grant where we can identify essentially the wait list you need to get that grant, and they can go in and whether it is repair their home or find them a more accessible house for what they are creating, trying to navigate it on that front. We are behind. Quite frankly, we are about 10 years behind where we need to be when it comes to what we are seeing, not only for seniors in housing, I would say for all individuals in housing, but those are the different avenues we're looking at addressing. Yep.
Commissioner Coleman.
Thank you, Mr. Chairman. Good morning, Kendrick. Thanks so much for being here. I have a very high opinion of you and your team and all the great work that you all do at AAA, so thank you so much. Following up on Commissioner Faber's line of questioning there, the supply of dollars and ultimately services is an ongoing challenge, but I just want to hone in on the kind of demand side, just knowing Kent County is blessed with substantial medical facilities and senior housing and lots of senior services. So not only is the demand for senior services increasing just because of like the demographic trends, in our country and our area, but I know that there are, many seniors that live in, other counties, and then when they need to, age, they move into Kent County because we have so many great options here for medical care and otherwise. So I'm just curious what you see as the kind of trend line in terms of additional like service demand focus areas, or potentially even brand new services that may be needed for seniors in the next decade that are different generation that than 10, 15 years ago that seniors were in Kent County.
So I'll touch on the first question first. The trend line we see, and when I would say when we look at our most, I would say taxed services, we were looking at in-home care, transportation, and even we're starting to see it more of a trend with meals as well, about when we look at those priority services and where is that demand growing, where are those wait lists growing, how many are we unable to serve with the dollars. I would say that's the trend of what we're seeing. We've been seeing, I would say, since about 2022, coming out of the pandemic for that. And then when we look at how we're able to leverage those services, but then also what are we doing to meet essentially those aging into our services, we're seeing a lot more access to technology. We're seeing more comfortability, whether it is for services like telehealth, whether it is they want to get their information in a virtual format, they want to be able to access these services and be more active and engaged in their community. What we would say, what you would walk into, say, a senior center 10 years ago compared to what you're going to walk in today, they've changed the dynamics. We've seen a lot more wanting to be involved in the community, wanting to give back time, but then also wanting that sense of purpose too, is what we're finding. So adapting to meet our needs on a technological side and advancing that, while still also being cognizant of some people still like that paper in hand and they still are going to get their information that way, is something we're actively researching and making strides to, especially when we look at the senior millage is going to be up here in another few years for another campaign to go for a vote for renewal. We want to make sure that we're adapting to meet those needs, and that's initially what we're seeing in that. Yep.
Great. Any other commissioners' comments or questions? It's Kendrick, excellent job. I guess a couple questions. When it comes to just, I guess, all populations, but our seniors especially, it seems like there's a lot of scams out there. Are we doing some things to help educate our seniors on not getting taken for online scams, giving away their houses? I know there was a situation in Wyoming, somebody basically gave away their home to someone. So are you seeing that a little bit? How are we helping protect some of our most vulnerable?
So unfortunately, we're seeing it a lot. Seniors are the most victimized when it comes to these scams, whether it's text, email, phone call. They are the most targeted audience. Our Kent County Elder Abuse Coalition is our answer to that. So we're trying to educate and keep up, whether it is, you're having a toll road that we've probably all seen come out, educating and getting the word out about that. But then they also have a case review team that meets on a monthly basis that goes through these scams and looks at how can we protect the individuals on a case-by-case basis, and then what marketing do we need to do. So we, push out whether it is somebody mimicking your grandchild. We try to educate to say, that's not actually taking place. And then we also try to make sure that we're giving them that education to call our number before you call them back, so you don't fall victim to it.
All right, well, thank you again. As much as we can do to help that part of our community with those type of scams and other items is very important. So, again, thank you so much. Great presentation. Nice
Thank you,
job.
everybody.
All right. All right, Commissioners, our next item on our agenda is brought to us by the Administrator's Office. This is the Ready by 5 fiscal year 2026 funding allocations. This will go to full board on August the 28th. The action requested is recommended to the Board of Commissioners to approve the allocation of $8,937,560 of the fiscal year 2026 Ready by 5 millage funds, as recommended by First Steps Kent, to approve the agreement for the administration of Ready by 5 services with FSK, to also authorize the board chair or designee to execute the agreement and approve amendments. Can I have a motion and support, please? Motion by Pakla, supported by Faber. Commissioners, comments, questions, concerns? If not, all those in favor, please say yes. Yes. All those opposed? That has been approved and will move to full board on the 28th. All right. Next item on our agenda is brought to us by the Administrator's Office as well. This is the senior millage funding allocations for the fiscal year 2026. This will go to full board on August the 28th. Do I have a motion and support, please? Motion by Womack, supported by Pakla. Commissioners, comments, questions, or concerns? If not, all those in favor, please say yes. Yes. All those opposed, that will go to full board on the 28th. Next item on our agenda is brought to us by the Parks and Recreation Department, purchase of land for addition to Millennium Park. I am just getting to my request here. So this will go to finance on 9/2. Then it is projected to go to full board on the 11th of September. Do I have a motion and support, please? Motion by Pakla, supported by Womack. All right, we do have Mr. Swayze here from our Parks Department. If anybody has any comments or questions regarding this purchase. Commissioner Faber.
Can't let a Parks item go without some questions. So could you just maybe give a little bit of background, and how many additional properties do we think there are kind of still out there in the Millennium Park universe?
Yeah, I guess that depends on who you ask, right? So I think if you looked at the core map, there's probably about a dozen or so properties that everybody agrees that at some point would be good for the county to grab to kind of finish the footprint of Millennium Park. I think you can go out there and make cases for some of the other ones, but this obviously is one of the, what I would say are the three most important pieces, because they're actually internal to the park. They're surrounded by park properties, so.
And then the plan would be to demo this and kind of just bring it into the park space?
Correct, yep. So the process for this piece of property will be similar to the piece of property the last piece of property we picked up, which was the corner of Maynard and Butterworth. So we were able to come to an agreement with the property owner. This particular property owner has plans to make improvements to a different property. So we are allowing her to stay in the property for a period of time so she can make those improvements. And then, so we will take over the property officially at the end of 2026. Plans for demo in 2027. And then we'll see how the acquisition of other properties in the area go.
Great. And then just want to take the opportunity to thank the Kent County Parks Foundation for their contribution. They're an amazing asset in our community.
Agreed.
All right. Thank you so much. Any other comments or questions? If not, all those in favor, please say yes. Yes. All those opposed, that has been approved. Next item on our agenda is, again, brought to us by the Park and Rec Department. It's a quitclaim deed of Surveyor Gapland. This will go to full board on the 28th of August. Can I have a motion and support, please? Motion by Favor, supported by Womack. Commissioners, comments, questions, or concerns? If not, all those in favor, please say yes. Yes. Also, all those opposed, that has been approved and will go to full board on the 28th. Next item on our agenda is brought to us by the Department of Public Works. This is property acquisition. Can I have a motion and support, please? Motion by Pakla, supported by DeBoer, and this will go to full board on the 28th. This was approved at the DPW at our last meeting our first meeting in August, but our last meeting that we had. We do have Dar and Nick in the audience if there's any questions regarding this purchase. Commissioner Pakla, myself, and Commissioner DeBoer were all in that meeting and were support of this request. Commissioner Faber.
Thank you. Can you just talk a little bit about the cleanup efforts for this site, or what's kind of the timing as we move forward, seeing as it's currently a junkyard, I believe?
Thank you, Chair Burrell, and good morning, Commissioners. Commissioner Faber, the way the contract is drafted is it gives the department the runway it needs to do all the environmental site assessment work. And based on that outcome, we can make a decision not to move forward with the acquisition should we find something that kind of would push us over the edge in terms of cost. It's expected, because nearly every property along that corridor has some level of contamination, that we'll find some ground contamination, some groundwater contamination. Even the properties that we purchased for the recycling center and our admin offices on the other side of the river have had some past industrial impact. So I would expect, just based on our past work, is that we'll file what's called a baseline environmental assessment. That's with the state. We'll identify if there's any soils that need to be removed. Typically with an industrial or commercial use, you're ensuring that there's due care and whether it's a paving or parking lot or other things to put that barrier in place, that those things are there to protect not only employees but the public that might be using the site. So we have an off-ramp in the contract. If we find something like a PCB or something that regulatory-wise would be challenging to the county to overcome, but we're pretty familiar with some of the other typical industrial impacts. So I don't expect it to be a problem, but we do, I would think, based on past use, we'll find something.
All right, great. Any other commissioners' comments or questions? If not, all those in favor, please say yes. Yes. All those opposed, that will go to full board on the 28th. All right, next item on our agenda is also brought to us by the Department of Public Works, and this is for a scale house attendant. Can I have a motion and support, please? Motion by Faber, supported by Womack. Commissioners, comments, questions, or concerns? All right, Commissioner Faber.
On a roll. So these scale house attendants have been traditionally, typically have at least been hard to find the right person. It's a unique skill set to deal with the public that just wants to get rid of their crap
Yes.
and is frustrated when they have to pay. Can you just talk about kind of retention of our existing scale house staff, why the need is sort of here a little bit more?
Sure. So we currently have 6.5 FTEs. To your point, scale house attendants our front of house, they're taking in, for example, at our North Kent Transfer Station, there was over 68,000 paid transactions, and triple that in terms of residents, businesses, others that visit the site to recycle, to drop off electronics, all the things that we offer at North Kent, provide directions. They're tough. We're scared of them most of the days because they've had to kind of steel themselves to the fact that you'll have an unhappy customer, and truck drivers can be a bit of a gruff group. But they also are highly respected and well liked by all the customers that use those sites because they're often repeat customers. We haven't had significant issues in retainage. Occasionally, you'll find someone that you've hired and it just isn't the right fit. But we do currently have 6 full-time and 1 part-time person. One of the things that we did a couple of years ago where we are having some challenges is we actually have 1 supervisor for all the attendants now. It's our financial supervisor that reports to our finance director, Kim Williams, who's actually here today, where previously each scale house attendant kind of reported to the local supervisor, but given all the challenges and needs in managing both the books and funds in, funds out, and just all those other things, having that person handling all their scheduling needs, taking care of PTO needs, being able to step in and fill in, I think that's been helpful. And I think while we do lose a scale house attendant occasionally, we've been pretty successful in retaining them.
One quick follow-up. I know at North Kent, we installed some automatic RFID technology, so those repeat commercial haulers at least can just roll across the scales and don't have to necessarily even engage with a scale house attendant. How is that working? Is that something you feel like is going to get duplicated at other sites? Or?
Yeah, it is actually working. It's a great question. So one of the things we did as we built out the new North Kent Transfer Station is we wanted to put in as much automation as possible. There's that tipping point of ensuring that the loads coming in match what's actually being paid for, and being that first line of defense. Again, we've got things like tires and propane tanks and just all these anomalies that can come in with the trash that might be billed differently. That said, we beta tested with Granger Waste Services a number of months ago. We've now added a second, and we'll be opening like once a month. We're adding additional drivers and trucks. So I believe there's 20 trucks among 2 hauling companies that are now using that kiosk where they can arrive, they put in their data. There's already a tier weight established for the truck, and they don't have to interact with our scale house attendant, but they are still there if there's a question or a need. So it's worked really well, and I think we'll continue to expand that, but it is specific to certain types of loads that come in. You're welcome.
All right, thank you. Any other comments or questions from commissioners? If not, all those in favor, please say yes. Yes. And that has been approved. That will go to full board on the 28th. All right, next item on our agenda, brought to us again by the Department of Public Works. It's the Sustainable Business Park Easement Acquisition and Right-of-Way Easement Conveyance to the Kent County Road Commissioners. Commissioners, I need a motion and support, please. Motion by Pakla, supported by DeBoer. All right. Commissioner DeBoer had a great comment at our DPW meeting. And Dar, if you can just talk just a little bit about the easement, and I think her question was related more to the Sustainable Business Park, but you had a great, I guess, response or knowledge on that I thought was helpful.
Sure, thank you. So a little bit of background is in February, our Board of Public Works gave us the approval to finalize design and prepare the bid documents for the Sustainable Business Park, which is an industrial park. As we moved forward, we learned that the Kent County Road Commission, Allegan County Road Commission, probably from experience, requires that all permits and easements and other necessary things be in place before they bid the road project. I think the question was around what if we don't develop the business park as envisioned, or it's used for another purpose, because the properties are master planned industrial. and because we have the planned unit development approval from Door Township, should the county decide to do something differently with that business park property, the easements and everything that's needed along that corridor on 100th Avenue, Clyde Park, and then into 14th as it goes into Allegan County, would still be useful. And whether we develop it or a decision is made to do something else, those easements and those right-of-ways would still be usable and valuable, and we could recoup those dollars with a different decision.
All right, great, thank you. Commissioners, comments, questions, or concerns? Commissioner Coleman.
Thank you, Mr. Chair. Thank you, Dar, for that explanation. I assumed that was the case. These are just general kind of access improvements. I'm curious about the utilities, like what are the utilities that were planned while the roads are torn up to like send through there? And then my other question is just, I guess, kind of a legal question on what our authority is related to easements in Allegan County. And these are kind of all bundled together, which makes sense from a project perspective. But I mean, clearly we can approve Kent County easements, but are we approving Allegan County easements in some respect here? So that's my two questions.
So I think the short answer is yes, it's property that the county owns. The majority of the Sustainable Business Park property is actually located in Door Township in Allegan County. The property was originally purchased over the years for expected expansion or development of a new landfill. So the easements that we have to grant to allow for road grading, for the placement of water, sewer, and those other utilities are being recommended by the Board of Public Works under the authority that would be approved then by the Board of Commissioners for the properties that we currently own. We're not extending easements or anything for property that we don't own. For example, the Kent County Road Commission and Allegan County Road Commission are both involved on the Kent County side and on the Allegan County side to ensure that the proper easements and right-of-ways are established so they can do the road improvements, and we can also put in the utility corridor for the water, sewer, and other things that are being recommended. Did I answer that, or?
I think so, but I thought I saw in there, so like some of the easements are, so in the Allegan County portion, Clyde Park, I forget what they call it in Allegan, what that.
14th Avenue, yes.
So some of the easements are our side, like I remember seeing like the grading permit and stuff, you know, to get into the property, I assume for some of the utilities, that kind of thing, but some of the easements were on the
You're right.
west side.
There are a few that are still required on both sides of the road. So we would be acquiring those easements for the road commission, or the road commission's acquiring them, and we're picking up the cost of that. So we're contracting with a company called Land Matters. They're a well-known agency that works with MDOT, road commissions, and others to actually acquire the easements that are needed on those private parcels. So we will be acquiring easements in those areas as required by the road commissions because they know the right-of-way and they know the width of the road and everything else that's needed to make the improvements, do the grading. So yes, you are correct. We are acquiring private easements in those areas that are needed, both on the Allegan and Kent County side.
Yeah, so are we approving just like we're approving the acquisition costs of, you know, getting these easements we're not approving the easements themselves. I assume like, you know, I know a couple of the Allegan County commissioners, I assume that's something they would have to like vote to approve the actual like easements themselves.
So I don't think so. So the way I understand it is there are easements, there are right-of-way requirements that the Kent County Road Commission requires that this board that the Board of Commissioners can only grant because you're either encumbering or selling property, which is the authority of the Board of Commissioners. The easements that will be that we're being requested to acquire so that we can continue, you know, that we can do the bidding and we have the proper properties under control, if you will, in that utility corridor. That would be acquired by Kent County for that utility and road corridor, for the use of road commissions to actually do the work. So we're acquiring it and essentially giving it to those road commissions, so they ultimately have control of and can maintain that road. So I don't believe that the Allegan County Road Commission's involved. We just have to acquire that from the private property owner along those streets, because they're widening it to accommodate a all-season road for heavy truck use. Where currently Clyde Park is paved but not an all-season road, and 14th Avenue is actually gravel. That's my understanding, and correct me if
Okay.
I'm wrong, Brian, but that's my understanding of that
That's
process.
helpful, yeah. I guess that makes more sense to me, that basically we're approving the dollars. They're going out and saying like, hey, neighbors, like, we need these easements, and just getting agreements from those private property holders in Allegan to get that right-of-way established.
Yeah, that's essentially correct. I mean, essentially, to do the road improvements, the road commissions want to have the legal easements in place and the rights of way in order to make those improvements, obviously, and they would rather not be dealing with these individual landowners. So we are going out to get those easements put in place so that the road improvements can be made.
Yes, thank you. That's
Thank
very
you.
helpful.
Great, thank you. Any other comments, questions, or concerns? If not, all those in favor, please say yes.
Yes.
Yes. All those opposed, that will go to full board on the 28th. So I just wanted to make a note. Kim, you're probably in one of your last meetings up on the 300 level here. So Kim will be retiring in October. So appreciate that. I know you'll be sorely missed. And again, appreciate your service to Kent County. And I want to mention it here upstairs. So again, thank you so much for your years of service. All right, commissioners, any commissioner miscellaneous? Commissioner Ponstein.
Thank you, Chair Burrell. More question for Al, and maybe just a request for information. We've got election seasons come up. We just went through one, and I think everyone saw millages for ongoing, for new, for increases, from anything from fire, schools, seniors, jails. And then we hear from the people from the agencies for seniors that when you get to the age, the ability for people to stay in their homes are being affected by, their house is already paid off, but the utilities, the taxes, and ongoing, and it's getting hit on both ends because it also affects the new home buyer, that there's not a lot of lower price homes available. It's getting more and more expensive to build them. Is that they could probably afford the mortgage, but they can't afford the utilities. Some of them have doubled. They can't afford the taxes. And it's just, are there any studies out there that show for every millage that this board agrees to or support, what is the effect on both ends of the spectrum on, are we losing people to the market? They're not going to be able to buy a home? Is there anything like that out there?
We don't have anything, an analysis of each of the special millages levied by the county and the general operating tax specifically looking at that, but we can do a search and see if we can find something close out there. I'm not aware, I know we haven't done anything like that.
But you can see where there's going to be a tipping point where we can only do, homeowners can only foot the bill. And that's it, it's homeowners. And it's services for people, a lot of them aren't homeowners. And, we've got a ballot, initiative coming up where they're trying to get signatures, and that in itself is scary, is that we could just, lose that. But, the points are being made is that the homeowners and their property taxes, it's just getting out of hand. So, I did want to do the search, and, you get the improvements for taxpayers and all these, advocacy groups, but I didn't know if there was anyone who's ever studied it, group of Pew or something.
We'll talk to the Housing Next folks, Ryan Kilpatrick. I'm sure there's been many studies done of the rising cost of housing, and I don't know about some of the utilities and taxes, ancillary things to that. I know we could pretty easily, and we have, I think, as each millage has come up, shown the impact on a home worth $200,000 usually, as far as what the millage does, what the cost of the millage is per year. We could generate a chart of all millages on one page showing that information, so at least there's an idea of what the impact each millage has.
And that's, that's difficult too, because the impact of one doesn't really show the picture of the impact of the cumulative millages.
I think from my perspective of doing this work for so long, I think that before Proposal A, we had fewer special millages. And so I think that the thing to balance, I think, is if you look at the impact of Headley in 1978 and Proposal A, which took effect in 1994, there's a tremendous amount of taxes that haven't been levied. So in essence, there's been quite a bit of taxpayer savings from that perspective. But in order to make up for some of that revenue lost, that governments don't simply see increasing in their operating, they have asked voters to consider special millages to look at certain aspects of things that can be funded with special millages. And some things are so unique they have to be. Anything related to certain services where you can't give a individual benefit with general fund dollars would have to be funded through a special millage. But I think in general, the rise of voter-approved millages has been partially to offset the big decreases in value that's taxed due to those two constitutional amendments.
So we're going to have to rely on Lansing to look at the bigger picture, taxation as a whole.
Good luck.
I'm not big on relying on, whatever.
All right, any other commissioners' comments, questions, or concerns? Seeing none, meeting is adjourned.